So this is your brain on drugs. When one takes drugs, the dopamine level becomes very high. When the dopamine level becomes high, they become very happy. They want to become this happy again and again, so they continue taking drugs, which causes addiction. This is when one takes drugs a second time. They got really happy the first time and want to get this happy again. But the truth is they can't get this happy again because the dopamine level doesn't go that high again. It'll still go high, but not as high as the first time. This will cause them to be not as happy. This will keep on happening every time the person takes drugs again. Now going out to the reporters at the village school who will explain about drugs and how they affect you.
Drugs are very dangerous and can cause many harmful effects to your brain and body. Biological, psychological, and social factors are known as risk factors. Many people also start abusing drugs due to their desire to better themselves physically or mentally. This also leads to the use of anabolic steroids and stimulants. However, taking drugs can have many severe effects on your body. Different drugs have different side effects. These types of drugs include cocaine, cannabis, hallucinogens, opiates, amphetamine-type stimulants, and sedative hypnotics. Drugs also harm unborn babies and affect your brain as well as your body. The first time you abuse a drug, your dopamine levels are 12 times higher than normal. Dopamine is a hormone in your brain that causes you to feel euphoria for temporarily. These extremely high levels of dopamine cause drug abusers to use them more. Some commonly abused drugs include marijuana, heroin, cocaine, meth, and MDMA. The choice to take drugs is voluntary most times. After the first time you abuse the drug, it becomes increasingly difficult to refrain from abusing it again. This leads to addiction.
Each year in the U.S., 2,500 youth from 12 to 17 abuse a prescription pain reliever for the first time. Most people who abuse drugs start in their adolescence. Once drug abuse starts, it causes many social effects. Some social effects of drugs include marriage relationships, family, education, employment, and financial issues. All of these take a negative impact while someone is taking drugs. A family member that takes drugs while the rest of the family doesn't take drugs might embarrass the entire family. Drugs will affect kids' performances tremendously in school. The students' grades will most likely tremendously decrease. Some of the psychological effects that drugs cause are severe depression and suicidal thoughts. Drugs affect you mentally by changing your mood and behavior, which eventually leads to changes in your brain. Everybody has these chemicals in your brain that try to send messages throughout the body. Some drugs interfere with these chemicals, and the messages the chemicals are trying to send doesn't happen. Physical effects of drugs are typically seen all throughout the body. Some side effects include seizures, a weakened immune system, nausea, vomiting, stroke, hallucinations, shortness of breath, depression, and delusions. The primary effects are usually in the brain. Drug addiction changes the way the brain functions and impacts how the body perceives pleasure. After a while, the brain adapts and starts to expect these drugs to come in. 1 in 4 deaths are from drug addiction.
Abusing drugs also affects personality. Whilst on drugs, many people's personalities take a negative impact.
Such personality changes include behaving irregularly or becoming antisocial. Many drug abusers also begin to put the need to take drugs before their friends and family. In everyday life, people, mainly teenagers, are influenced to take drugs. In fact, 90% of prescription drugs addicts start in their teenage years. Most people first start abusing drugs because of peer pressure, social anxiety, or depression. Peer pressure is a key factor. The people around the person greatly influence him or her. Role models such as the parents or older siblings are key examples.
Drastic changes in one's personality when they are on drugs. If someone who has temper problems decides to take drugs, they might become extremely violent. On the other hand, they might think it's changing their personality for the better. If a normal shy person decides to take drugs, he might become outgoing and put his insecurities behind him. This may seem positive, but it is not. Drugs can change someone's personality emotionally. Their mood fluctuates unhealthy. In conclusion, it is the choices we make that influence our life. Therefore, we need to make good choices for ourselves.